Hello, my name is Dr. Daniel Su. I'm a urologic oncologist. If you're watching this video, I'm sure you have a lot of questions about PSA and prostate cancer screening. So in this video, I'd like to go over what is PSA, its role in prostate cancer screening, and the risks and benefits of prostate cancer screening with PSA. So let's start with the basics. What is the prostate and what does it do? Well, the prostate is a small gland that sits between the bladder and the urinary control mechanism. It's not a critical or essential organ, so a man can live without it. The problem is the prostate is surrounded by critical structures such as the bladder, the rectum, and nerves that serve for sexual function. So treating the prostate for both benign and malignant indication becomes a very delicate task. Unfortunately, prostate cancer is the most common cancer in men. So we need to figure out ways to work with the prostate and make sure that we are screening for prostate cancer appropriately. PSA stands for Prostate-Specific Antigen. It's an enzyme that's produced by both benign and cancerous prostate cells. The enzyme itself is not harmful. It actually has a fertility function. Elevated or high PSA level does not always mean a man has prostate cancer. There are in fact many other reasons why the PSA level could be elevated. The test is very useful for screening and management of prostate cancer. It's being used for more than 20 years. So what does an elevated PSA mean? As I mentioned before, it's not always due to cancer. In fact, an elevated PSA level between the level of 4 and 10 often does not mean prostate cancer. The PSA level does rise in linear fashion. In other words, the higher the level, the more likely a man can have cancer. But this is all based on probability, and it's not black and white. There are numerous studies that were carried out in the last 20 years to determine what is a good level to start getting worried. And based on these studies, a PSA level of 3 is often when we start screening, we start becoming concerned for prostate cancer in a man. So PSA is actually not a very stable test. There are many factors that can either increase or decrease the levels. If we're talking about a PSA of 4 to 10, things such as infection, both urinary and non-urinary, can increase the level. Sexual activity, recent urinary procedures can also increase the PSA level. There are actually medications that will reduce PSA levels as well. So in the process of screening for prostate cancer, your doctors will take these factors into consideration so you have the most accurate PSA level possible before the next step is taken. So what are the benefits? Well, you may have heard a lot of controversies surrounding PSA screening in the last 10 years. If the test is so unstable, why do we use it to look for prostate cancer? There are actually been many studies that looked at PSA in its benefit to reduce death from prostate cancer. And in fact, PSA screening does reduce the chance of death from prostate cancer. It also reduces the chance of the cancer spreading before it becomes incurable. Ultimately, PSA screening is currently recommended by most screening guidelines. So what are the risks? So even though the test is a fairly good test, and it is the best test we have as an initial test for screening for prostate cancer, there are also risks. As mentioned before, the PSA level can be elevated for non-cancerous reasons. So if the test is not used properly, it can lead to unnecessary biopsies, which causes a domino effect and can lead to treatment of clinically insignificant prostate cancers. However, when the test is used in the proper context with a proper protocol, it can reduce death from prostate cancer. Thank you for watching.